Welcome back to the Ultrasound Clinic. Today we are going to describe the breast anatomy. First of all, we have to understand the layers of breast. There are 4 to 5 layers of breast. We'll begin from the skin. Here is the uppermost, outermost is the skin. It is outermost thin echogenic line about less than 2 millimeter thick, and sometimes a little thicker in areolar region it may be, but it is less than 0.2 millimeters, 0.2 centimeters or 2.0 millimeters. And another layer is subcutaneous fat. Here is the subcutaneous fat. Below the skin, we will find this subcutaneous fat. It is a hypoechoic dark areolar area just below the skin, and it is traversed by thin echogenic Cooper's ligament. These are fibrous bands giving support to the breast tissue. And the third one is glandular or parenchymal layer. Here is the third one below it, this one, you see. So it has got mixed echogenicity. Sometimes it is hyperechogenic and sometimes hypoechogenic, and that relates with the fat. And it contains ducts, lobules, and glandular tissues, and is more developed in younger women and replaced by fat with the age. The fourth layer is retromemory fat. You see, here is the retromemory fat, this one, last one layer. This is the retromemory fat, and it is hypoechoic layer beneath the glandular tissues. And it is thin echogenic line, may be seen, may not be seen sometimes because located in the deep locations. So the fifth one is pectoral fascia and muscles. Here is the pectoral fascia and muscles. They are quite deep, and pectoral's major appears as a hypoechoic band with echogenic striations. So this is the last muscle of the breast, and pectoral's minor sometimes she can be seen deeper, but is quite in my experience, I have detected it quite less. So pectoral's major is usually seen, and the sixth and last layer is the ribs and pleura. Ribs are rounded hypoechoic, as you know. They've got echogenic rim and cast posterior acoustic shadows, and the pleural line is a bright echogenic line deep to ribs, moving with respiration. Let me show you that. This last line, but it is quite darker here. But this is the pleural line. So these are the layers of breast. We must have to remember all these things. Now let me show you a pathology I have found over here. This woman complains of swelling in the right breast, just above the nipple level. तो वहां पे इसको पकड़ के रखें, जहां पे था वो पकड़ के रखें. Yes. मानी के बंद करें. She complains of some kind of swelling, painless swelling in the right breast. So we have found this cystic structure. It is a complex cyst showing internal debris and slightly irregular in outline, though she is not febrile and neither complaining of severe pain, but it appears to be complex and inflammatory cyst, I think. So let's describe the features of this cyst. Actually, there are two kinds of cysts in the breast. The first kind is simple cysts. They are well circumscribed and fluid-filled lesions within the breast, most often benign and identified as on ultrasound by its sonographic features. So the simple cyst can be said as anechoic, thin-walled, oval, and posterior acoustic with a posterior acoustic enhancement. There is no internal septation and no internal vascularity. However, the complex cysts are quite contrary to that description. Like there will be low-level internal echoes like in this case we are seeing here. Just watch it. There are quite low level internal echoes, and by showing also some there is no septation. Okay, and wall is slightly thickened, and sometimes they are not thickened, but this wall shows thicker. So this is a complex cyst measuring approximately 1.5 into 1.2 centimeters, and this is quite different from the solid masses. I will describe it later, but this is the some complex cyst. So this was that. Thank you very much.